Hi, come on in and learn with me today. We're going to walk through several sliding scale programs that can make everyday essentials more affordable. And I want you to feel confident understanding what's out there, how the income tiers work, and where you can start. My goal is to make this feel simple, clear, and doable, not overwhelming. And just a quick note, this session is for educational purposes only and isn't a substitute for professional, legal, or financial advice. When you hear the term sliding scale, think flexible pricing. Instead of one flat fee, the cost adjusts based on your income, your household size, or your current financial situation. What surprises most people is how wide these income ranges actually are. Sliding scale pricing shows up in more places than you might expect. Healthcare, counseling, youth programs, utilities, services that you may already be using or you may need. This approach is designed to make essential care and support more accessible, especially when costs feel unpredictable or out of reach. When you look at the actual numbers behind sliding scale programs, it's eye-opening. Many programs use 200 to 400% of the federal poverty level, which covers a much wider income range than most people expect, including households earning what feels like a solid middle income salary. You might not land in the lowest tier, but you can still get meaningful reductions that make services more manageable. So if you've ever thought, I'm probably too far above the limit, this is the moment to take a second look. The guidelines are often far more flexible than they appear on paper. You can get reduced cost care at community health clinics, even if you already have insurance. These clinics offer primary care, women's health, chronic disease management, labs, and sometimes dental, all on a sliding scale based on your income. I've added the website on this slide so you can quickly check what clinics are available in your area. It's one of the easiest ways to find affordable care that's close to home. These clinics are built for people who are working hard, juggling bills, and still feeling the weight of rising cost. So if healthcare has felt out of reach or unpredictable, this is a great place to start exploring your options. When we talk about sliding scale programs, one of the biggest questions families have is whose income actually counts. And this is especially important if you have adult children living at home. Here's the key thing to remember. Most programs do not count the income of adult children unless they're part of your tax household or they share income and expenses with you. For Medicaid, CHIP, and Marketplace, they only look at your tax household. So if your adult children file their own taxes, their income is not included, even if they live with you. For community health centers and sliding fee clinics, they use something called an economic unit. That simply means the people who share income and expenses. If your adult children pay their own bills or handle their own expenses, their income usually isn't counted. And for programs like LIHEAP, they look at who contributes financially to the household. If an adult child lives with you but doesn't contribute to the household budget, many states will not count their income. So the bottom line is this. Living in the same home doesn't automatically mean their income affects your eligibility. If they file their own taxes or manage their own expenses, they're usually not included. Counseling can feel expensive, but there are real options that make it more accessible. Many therapists, counseling centers, and nonprofit mental health organizations offer sliding scale rates that adjust to your income. Even if you have insurance, you can still get a reduced rate, especially if you're dealing with high deductibles or limited coverage. If you're not sure where to start, I've added the National Mental Health Resource Line on this slide, along with the website where you can search for low-cost counseling in your area. Both are great places to begin if you're trying to find support that fits your budget. You'll also see my website listed on this slide. I keep a growing library of micro lessons and resources there, so you can visit this topic anytime and explore additional guidance at your own pace. And when you reach out to a provider, it's completely okay to let them know you're looking for sliding scale pricing. They hear that every day, and many already have options in place to help. Additionally, the YMCA offers reduced rates, the local community centers do, and some of those include memberships, swim lessons, sports, and even summer camps. What most people don't realize is that the income guidelines for these programs cover a wide range of working households, not just the lowest tiers. If you've ever looked at these activities and felt unsure about the cost, it's worth checking the sliding scale options. There's often more flexibility built in than you might expect. You may also qualify for sliding scale pricing for after-school programs, tutoring, arts programs, STEM clubs, and community-based youth activities. Some programs only require basic income information, and others allow self-reported income if paperwork is a barrier. I've added the childcare.gov website address on this slide. It's a helpful place to search for after-school and childcare programs in your area, especially if you want to compare options or see which ones offer income-based rates. If your child is involved in activities that feel financially heavy, it's always worth asking whether sliding scale pricing is available. Many organizations offer them, families just don't always know to ask. Utility costs can add up quickly, and many companies offer tiered assistance programs that adjust based on your income. These programs aren't limited to very low income households. Their ranges are much broader than you might expect, and they're designed to help working families who are feeling the pressure of rising costs. Most utility providers have a quick online screening tool you can use to see if you're eligible. I've also added the 211 number on this slide because it's one of the easiest ways to get connected to local utility assistance programs. You can call 211 from anywhere in the United States, or you can visit the website listed here, and they'll point you towards LIHEAP, discount programs, or community resources in your area. And if you want a deeper breakdown of LIHEAP, specifically, I have a full video called Struggling with Your Electric Bill that walks you through it step by step. Income tiers can feel confusing, so let's make this simple. On this slide, you're looking at the 2026 eligibility thresholds for a family of 4. The dollar amounts at the top of each bar show the income cutoff for that tier, and the program that income level applies to is listed right below the bar. This layout makes it easy to compare where your household might fall across different types of support. These tiers aren't about labeling you. They're simply a tool to match you with the right level of help. And here's the part most families don't expect. You might fall into a tier that gives you a discount even if you've never qualified for anything before. Don't assume you're automatically overqualified. You might be right in the range where support is available. I want you to hear this in a really clear way. Using this sliding scale pricing does not take anything away from anyone else. These programs are built with multiple tiers so they can support a wide range of people at the same time. You're not taking a spot. You're not limiting someone else's access. You're simply being matched to the tier that fits your current financial situation. Sliding scale options exist because life is expensive, incomes shift, and families need support at different levels. Using these resources isn't taking advantage, it's using a system that was intentionally designed to make essential services more accessible for you too. Here's where you can take real practical steps. Most sliding scale programs only ask for a few basic pieces of information to get started. Proof of income or a recent pay stub, your household size, a short application. Some programs even allow self-attestation, which means you can simply state your income if gathering documents is difficult. That's especially helpful if your hours change, you do gig work, or your income has shifted recently. The biggest barrier isn't the paperwork, it's simply knowing these options exist. I've also added the ASPE website on this slide. If you want to look up the exact federal income guidelines for your household size, not just the family of 4 example we walked through earlier. That's where you can find the official numbers. I want you to feel confident asking one straightforward question that opens the door. Do you offer sliding scale pricing? That one sentence can make healthcare, counseling, youth programs, and even utilities more manageable. And if someone in your life is feeling stretched, a parent, a neighbor, a coworker, anyone navigating that in-between zone, share this with them. It might be exactly the clarity they've been needing. Thank you for spending this time with me today. I hope this helped you see what's available and gave you a clearer path forward. Sliding scale programs are here to make essential services more accessible, and you deserve to explore every option that can lighten the load. If you realize you might qualify for something we covered today, feel free to go back and rewatch the sections you need. Take your time with it. This information is here for you whenever you're ready. If this video helped you, or if you think it might help someone else, please share it. And for more healthcare insights and micro lessons, you can always visit my website at sunnyvibes.com.